To differentiate CTE from a concussion is an impact to the head that results in symptoms immediately thereafter. And those symptoms can last moments, minutes, hours, days. But it's transient and it gets better in almost everybody. CTE doesn't occur immediately after the hit. It occurs usually years later. And it's not due to a single impact to the head. We think it is related to repetitive hits to the head. In our research, we've shown that it's about years of play. So for each additional year of play, the risk of developing CTE increases. We've never actually shown that there is a relationship between a single head injury or a concussion or even number of concussions and CTE. It's more this accumulation of hits over the course of an athletic career or perhaps in the military or in other settings. We have this really clear link between this exposure to repetitive hits and the neuropathology. So when we see sports leagues reducing the amount of hitting in practice, and when we see youth leagues starting with non-contact and soccer leagues heading less until athletes are older, all of those things we think probably reduce the risk of individuals developing CTE later in life.